16 people have died of Lassa fever in Nigeria in less than a month. 61 cases have been confirmed across the country. A total of 107 suspected cases have been recorded in 10 states of Edo, Ondo, Bauchi, Nasarawa, Ebonyi, Anambra, Benue, Kogi, Imo, and now Lagos State, according to Health Agency, Nigeria Center for Disease Control, NCDC. Between 2005 and 2018, the hemorrhagic virus has claimed 40 health workers. The Commissioner for Health, Imo State, Angela Uwakwem, joins us via, of course, via telephone from Imo State. I want to thank you so much indeed. Also in our Abuja studios is Dr. Disu Oyewoga. He's a public health consultant. He joins us from our Abuja studios. I want to thank both of you for coming on the show. Let's begin with you, Commissioner. 2 states, including yours, Imo and Lagos, have become the latest states recording Lassa fever. Tell us the situation that you're being confronted with in Imo.
In Imo State, we had an index case that passed through 3 hospitals, and the patient tested positive and died. That patient led us to 38 contacts, because that's across the way, 38 contacts in all, out of which we have 22 of them that have been placed on post-exposure prophylaxis. We had 7 suspected cases, and some of them we are still awaiting the results of their tests. All the contacts have been placed on various degrees of quarantine or restriction. Some are in the hospitals where these patients pass through. We shut down the hospitals to public service, and we are closely watching all the 28 people that have been that are contacts. None of them is symptomatic for now, but those who are high risk are on prophylaxis.
Tell us, does the demography and the geography you have in Imo State, does it limit your response time to get to hinterlands, to villages, for instance, when you have a case like that reported in those areas?
Incidentally, this Lassa situation is not in a very difficult to get area. It's in around Olo. Imo State has 3 senatorial zones. The Lassa fever thing is around Olo, and it's not a hard to get area. It's not a difficult terrain for us at all.
So how well is your public health architecture positioned to respond to this kind of cases?
We have been containing the situation. We have tracked cases. We've been to the place. We have followed up on contacts. Every day we get an update on them, and we have daily meetings. We're working in partnership with WHO and with the Center for Disease Control. And the test samples are at Irua. They are done at Irua Teaching Hospital. And every day we have meetings to review the situation.
Okay, let me put you on hold for a moment or two, and let's talk to Dr. Oyewoga in Abuja. Lassa fever is not new, really, to Nigeria, and by extension, the tropical region in Africa. What must governments begin to do, especially the Nigerian government, what must we begin to do to ensure that we're able to contain this ravaging virus?
Hello, I didn't hear the last part of your question.
Yes, I was just asking you. Okay. Brilliant, thank you. I was just asking you that indeed Lassa fever is not new to Nigeria by any standards, and it's also not new to the tropical region in the country. What must government do or begin to do in the wake of this ravaging virus?
First and foremost, what government needs to do is to sensitize the public, to create awareness about this virus, and the signs and symptoms of the disease must be known by the people, because it usually comes like malaria fever. And usually when you treat malaria and it is not going, the next thing you should do is to go to the hospital, to be screened for Lassa fever. So it's to create awareness in the community, sensitize the healthcare workers, because they are the ones that will receive these patients when they come to the hospital. And also the policymakers should also provide the necessary support that will provide protection for the healthcare workers and prompt treatment and access to care for the people who are sick from the community. Essentially, government is to create awareness and then create an enabling environment for the healthcare workers.
Brilliant. Let me take you back. Let me take you back to 2012 yes. and a situation that we confronted in this country, starting from Lagos State, where the government responded in the case of Ebola. Would you say that because Ebola was alien to Nigeria, will that be the reason why everyone became so alert and together fought its spread? As to Lassa fever, which is very familiar with our people, would you draw a contrast between that and see how well we're able to establish if people are really serious about taking Lassa fever as a dangerous virus?
I think the issue with Lassa fever is because people perceive it's not as deadly as Ebola. But the lessons we learned from Ebola is for us to respond by reporting early when we see the conditions that mimic Ebola, like Lassa fever. And before Ebola came into this country, I will agree with you that there has been Lassa fever cases. Probably people have not been reporting. But after Ebola, because Ebola and Lassa fever belong to the same family, so people are aware of this and they quickly report. And that is probably one of the reasons we are having increase in the number of reported cases. So also our institutions, like Nigerian Center for Disease Control, has also been on its on the go. And the Nigerian Center for Disease Control is also strengthening surveillance in the country, creating awareness, providing enabling environment. I think with that, we're able to get more cases that are reported, and that is the only way we can get to the root of this problem and solve the problem once and for all.
Let's get back to Commissioner Uwakwem. This is largely a result of the rodents, rats, and getting into people's food and eating it. What steps are you taking to protect persons, for instance, in Ebonyi State, when this was recorded earlier last week? Schools were closed down as a result, and there are also localized villages, or even in city centers, especially when you have to consider barns where grains are stored, which is a hot target for rodents. What are you doing in this regard?
We have enlightened people as to the role of rats and how to treat food items in order to minimize the chances of contamination. We have encouraged people to put rat poisons in a bid to getting rid of rats. We have also tried to encourage them by enlightening them on symptoms and what they must do as soon as they have the slightest indication or suspicion of the condition. We're encouraging people to have regular hand washing, and we have not considered the option of closing schools because, by and large, the situation is contained. We have been able to determine precisely where the condition is coming from, and we have our close eye. So we don't want to cause an unnecessary scare or panic for the public. All the people, including the doctor and the medical staff that attended to the patient, are fine. None of them is having even any symptoms so far. And so we don't see the reason to immediately close schools.
I want to thank you both for talking to us on State of the Nation. Many thanks indeed to the Commissioner for Health in Imo State and, of course, a public health consultant in our Abuja studios. I want to thank you so much indeed. And to you as well for being part of the show. Many thanks indeed for watching. This is State of the Nation. I am Gimba Umar. Bye for now.